A lot of leaders and innovators talk about disrupting healthcare. But what does that really mean? And how does one actually do it? On Life-Centered Healthcare, we dive into these questions and more, talking to innovators who are leveraging Clay Christensen's theories to transform our healthcare ecosystem. I'm Ann Somers Hogg, Director of Healthcare at the Clayton Christensen Institute, and I hope these stories help inspire you along your journey to transform health and care.
Today's topic is a big one, and I'm going to start by asking you to think about where you turn when you're fearful. I'm betting it's to someone or something you trust. In healthcare, trust is paramount. That's because we seek care in some of our most vulnerable moments, often when we're driven by fear of the unknown, whether that's for ourselves or for someone under our care. So as we see more and more use cases for generative AI in healthcare, I have a nagging question. Is it trustworthy? Similarly, I wonder, can it ever be as trustworthy as a provider with whom I have a relationship? Joining me to tackle these questions and more questions today is Todd Dunn. Todd is an innovator and an entrepreneur. He's focused on innovation for more than 10 years. He's worked for notable organizations such as Cisco, Siemens, McKesson, GE, Intermountain Healthcare, and Advocate Health. While at GE, Todd was part of the early team chosen to shape GE's global innovation effort that eventually became known as GE FastWorks. He has educated hundreds of teams in the practical application of innovation theory, methods, and tools to improve innovation outcomes and impact for consumers and companies alike. Todd was recently awarded Modern Healthcare's 2023 Top Innovator Award, which was very well earned. You might not say that, but I would. So Todd, thank you for being here.
Thanks for having me. It's always good to see you, Ann Somers.
Todd and I used to work together at Atrium Health, now Advocate Health. And as I thought about who to have this discussion with, I couldn't think of someone more well-suited than Todd. You'll hear us talk about the theory of jobs to be done in this episode. And if you aren't familiar with it, go back and listen to episode 2, where I give a longer overview of jobs to be done. I'll also put some links in the show notes for a deeper dive on what I believe is a life-changing theory and a problem-solving tool. Okay, without further ado, let's dive into the discussion. And Todd, you know this, listeners know this. I like to start with why. Could you tell us why you work in healthcare innovation?
To make a difference. In short, years ago, I sat down with a CIO of a hospital, and we were building software for them. And he looked at me and said, "Todd, you make my life hell." And it really provoked me because I was in an operations role at the time and I didn't quite understand what he meant. And then he explained that the users hated the product. And that changed the way I thought about the world. I thought, how would I improve the inputs so that amazing engineers and people doing the coding would know exactly what to do to delight a customer? And that motivated me to start making the change toward a career in innovation back in 2009.
To make a difference. What a great answer, Todd. And building off of that, there is perhaps no innovation getting more attention or seeking to make more of a difference today than generative AI. And let's dive in the deep end of this with healthcare. There are a lot of presentations, there are a lot of podcasts, there are a lot of papers out there about what you should think about generative AI in healthcare. But this isn't that conversation. I want to help listeners think about how to think about generative AI in healthcare. So with that background, what are some approaches that help in thinking about this topic?
Wonderful question. We've known each other long enough. It probably doesn't surprise you that I try to think about AI through the lens of the jobs theory, but all three dimensions, the functional, the social, and the emotional dimension. And as I've thought about this in great detail, I'm very concerned about the imbalance of what I would call of the dimensions of this. Functionally, we're clearly spending unbelievable amounts of money to try to say that it works. Socially, I think it's an oversaturated dimension of progress. It seems to me that everyone wants to latch onto it. It's almost like the cool kids club piece. And I'm not being critical that way. Just everybody's running to the soccer ball. The thing that concerns me most is what is the emotional dimension of AI in healthcare? Can the clinical person who's supposed to rely on it for guidance trust it? And so I think about those three dimensions, and where I really get concerned is we haven't determined what the criteria of trust is yet. I feel that hospital systems are sitting in the rider's seat, not in the driver's seat. That all the money that's going into it and the marketing and the energy seems to be coming from the people who will make money off of it. Our clinical teams will be making decisions off of it. And can they emotionally trust what it's telling them to do, I don't know that they can. And so I would say we need to be very cautious in turning over the currency of trust, the emotional dimension of AI, before it deserves that currency of ours, especially, to your point, Ann Somers, in healthcare.
Todd, I want to dig into something that you said there around the currency of trust and whether or not the clinicians who are relying on it for guidance can trust it. Because I had come to the problem through the lens of the patient or the consumer, thinking about, can they trust it? And the question you're asking is even more fundamental. Let's dive into that a little bit more if we can, because you also said something around the fact that effectively the money makers in generative AI aren't the decision makers. So the health systems are in the rider's seat, not the driver's seat. And that imbalance is not optimal. So if we think about that mismatch, do you see a pathway, or what do you see as the pathway to addressing that?
If I were sitting in the decision seat for a healthcare system, this is what I would do. I would create a data set where the artificial intelligence company has to come to my facility. Now, if I can put that in a secure cloud with Amazon or what have you, I would. But I would put data sets specific to service lines, and I would organize AI around service lines, just like we have care organized around service lines. Then I would get the clinicians in those service lines to tell me what would cause them. Like in the jobs theory, we're looking for causal reasons. What would cause you to trust it? What would cause you to distrust it? And I would understand that in depth by immersing myself in their context, watching them make decisions, listening to them make decisions. And then I would set up the rigor and the governance for these AI companies to come in to my data center with my service line criteria and run their algorithms against our data. And then it would have to meet that currency of trust, that criteria of trust, before we would ever think about spending $1 on it. The reason that I would do that is because I believe a cardiologist will make decisions a bit uniquely different from an oncologist or a pediatrician. And I think they ought to be able to set the criteria of what trust means in the context of care with the patient. So I would organize it around service lines. I would have criteria around the service lines. And I would make sure that the people using it to guide decisions with a patient, a sacred thing like you mentioned, that they would have the sign off on whether or not to purchase it or use it.
Great. So putting more power in the hands of the clinical decision makers, and that would be driven by a greater understanding of their context, the struggles that they face. What do they view as the criteria for trust? Mm-hmm. I really like that approach.
I think it deserves the rigor.
Building off of what you said about jobs to be done, what are some jobs to be done that you think generative AI is serving well in healthcare today? Are there places where that currency of trust is well established?
Well, my jury's still out a little bit on it. I think that with some cases, I believe in imaging, it's doing a good job of assisting or augmenting clinicians and making them feel safer about the decisions that they're making. So I'm sure there are areas that I'm not aware of. On one end of the continuum, if you think about robotic process automation and it's generating answers or whatever on your behalf, I think that's probably doing a pretty good job. The reason that I offer those is because I think the criteria of trust is a little less stringent there, because the mistake that it makes can still be overcome by a human. And so I think it's there. Another reason my jury is out, Ann Somers, is because I haven't seen the criteria of trust in writing. I want to see the scorecard of trust and the scorecard of trust over time. I want to see the longitudinal performance of it in parallel to human performance to see, can we really turn the trust over to it or not? I just don't know that we can yet because I haven't seen it. And the emotional dimension of progress that clinicians need to make. And by the way, as patients, we give a lot of our currency of trust to the clinician, trusting that they have all the tools they need to make the better decision on our behalf. And that's why I go to that. I want to see the currency in writing. I want to see the longitudinal study almost in a phase 1, phase 2, phase 3, just like we do with a drug trial. I think we need to be that rigorous because it's going to make decisions so quickly that if it makes them too quickly and they're bad ones, we can exponentially harm people emotionally, physically. So my jury's still out. I want to see it in writing.
That makes sense. And how it comes back to the currency of trust, which makes me wonder back to how you would address the mismatch between the money makers and the decision makers. And you'd really want to understand the context to create the criteria of trust. Do you know of anybody who's doing that work? Are there any startups out there doing this? Are there any health systems that are starting to map this? Who are the innovators?
I don't know that anyone's going to that level of rigor yet. There may be someone, they may be keeping it quiet. I know that HCA is doing some amazing work with Google on nurse handoffs. I've read a bit about that. I don't know that the currency of trust has been dictated there, but I assume, because I know the person who's leading that, Dr. Schlosser, is very rigorous. He's a neurosurgeon. And so I think he thinks very carefully, methodically about it. What I would like to see, Ann Somers, and one of the other currencies that I believe these early stage companies and even large companies like Microsoft, the thing they don't have is the data. There's a currency to that data. And if we can force them to live inside of our data centers and prove it with the clinicians, I think we'll be better off. But I don't know of anyone going to that level of rigor yet. And it's a little bit back to your original question. I think we're outrunning ourselves. We're ahead of it from a social dimension. Like it's the cool thing, but yet if we peel it back, is there enough there to give our emotional currency to it? And even in low margin businesses, is it worth yet the risk and the money without the defined rigor? If you ask me bluntly to say, is it or is it not? I would say no. Not until that level of phase rigor is in place for us to give over the trust to it.
Right. That I'm familiar with the HCA example that you're talking about, but a good question on whether the level of trust is really there yet.
I don't know.
This next question would probably be a lengthy answer, but I'll maybe ask you to provide just a couple examples. What are some jobs that you think generative AI is attempting to serve in healthcare, but is not serving well today?
Okay. In an interesting way, I think about the job of think flow. One of the things we're trying to accomplish when we think is to make better decisions. And I'm not sure yet that clinicians believe that AI makes it safer, more comfortable, easier for them to think. And because I always believe that think flow precedes workflow, I don't believe yet that AI is helping in the job of making decisions, if I were to shorten it that way. I'm really concerned about that because they're taught to think in a very critical, methodical, safe way, and then we interject something. Well, is it really serving the job of making decisions and the dimensions of that job? I don't think so. But I haven't seen it in a way that a clinician would say, absolutely, I love it. It makes my life easier. It makes me feel safer in taking care of people. And the outcomes, the clinical outcomes are better. And I feel cognitively less fatigued in addressing complex issues. If someone has it, I hope they send it to you and they completely smack me around in public and say, oh, you're missing it. That would be a pleasant surprise.
All right. Well, if that happens, I'll let you know. Think flow precedes workflow. I really like that phrase. It's not yet helping clinicians with the job of help me decide. With the foundation that clinicians aren't trusting it yet, let's look at the other side of the coin, the patient or consumer perspective. What do you think the pathway is to establishing greater consumer trust in generative AI? And do you even think that's a pathway we should pursue?
I do. I believe it is a path we need to pursue because of the moral obligation we have to let patients feel safe when they're in the care of a provider. When they are prescribed a medication, I think a lot of people understand that the FDA has a path of rigor to prove the safety and the efficacy of a medication. And so to the same degree that the pharmaceutical industry has gone through, along with doctors, to explain to patients what the indications or the contraindications of a drug are, I believe we need to spend time making sure that patients understand that if AI is present in the decision, here's why they can be comfortable with a clinician using it as a guide to care for them. I think we have an obligation to tell them. If they don't want to know, that's their choice. But for us to not share that, I don't believe is the right way to approach people.
So we have to have transparency in all interactions that are based in some sort of AI.
I believe so. I think one way, if I may go back just a second, if not, tell me to stop. When I was at Cisco Systems in 2000, we were working on a project called the Cisco eHub. We were bringing MRP data, material requirements planning data, into a hub from around the world every night, from Penang to Austin to San Jose. And one of my jobs was to work with the top 15 supplier stakeholders in building out how they would use it. Much to your point about AI, how am I going to use it? And as we would dive into those meetings, often very early to accommodate global schedules, a wonderful person said, how can I trust this? And so I started thinking, like, what do you mean? So when I make a decision to buy something or to move something, how do I know that I can trust the data? And so we set off on this journey to figure out how to ensure people making decisions that they could trust the data that was being used to drive the decision. So a wonderful friend of mine and I, Jim Linder, and I sat in a room and we created a data integrity monitor. And along with our partners, we had every rule around what the data format should be, the timing should be, all of it, the cardinality rules. And we built a data integrity monitor that sat on top of the data. And then let's say that you were a purchaser. If you were looking at some of the reports, whether it was an inventory report or a forecast report, we had a timestamp of the data. Write a visual timestamp that would tell you that the data met all the criteria for you to make a decision on. I believe healthcare needs to do the same, Ann Somers. Even if it's a little visual in the top right of the EMR that says, okay, wherever you're going to display this information, that it should reassure the clinician, the person making decision, that the data has met all of the rules of timing, of quality, every other criteria that you would say, so that they know that they can trust it in the moment of how they're thinking about interacting with the patient. We have to go to that level. If we were going to that level to build routers and switches, it seems logical to me that we would go to that level for something as critical and sacred as making healthcare decisions with people.
Yes. And I love that you went back to that example because it actually leads to the next topic that I wanted to talk about, which is guardrails around generative AI. Mm-hmm. Clayton Christensen said that questions are places in your mind where answers fit. And if you haven't asked the question, the answer has nowhere to go. Yeah. And there are many questions to ask as we move forward as healthcare field and we grapple with the role of generative AI in our future and what it means. I believe one critical question is, what industry guardrails do we need in place to help ensure that we keep healthcare human-centered and primarily human-delivered? This is a big question. We would need a lot more time to answer it in full. But how do you think about tackling this? Or how would you think about answering that question?
The guardrail, in my opinion, has to be defined by the moment that matters and the people in the moment. So let's say Dr. Christensen, or my daughter is going to be a doctor someday. The guardrail should be whether or not the clinician believes that it's safe and that it helps her or him make a better decision on behalf of the patient. And then that guardrail would be criteria that has to be met by the algorithm, by whatever it is. To me, that's the ultimate guardrail, is to have the blessing, if you will, of the people who are the most deeply responsible for the decision that will be aided by the generative AI solution. The ultimate guardrail. The other guardrail, I would say, is we really need to build a data integrity monitor by service line. What's the quality of cardiology data you need? What's the quality of oncology data that you need? And segment it just like we have the structures of service lines segmented today, and let those governing boards determine what safe and efficacy means in the moment of truth. Those would be two things that I would say, if we get those right, we're putting the necessary rigor to using AI in a productive, effective way?
I knew you were the right person to talk to about this. You had such a clear answer, and I thought it was such a hard question.
It's a hard question.
Okay, Todd, my last question for you.
Okay.
Is there anything I didn't ask you that you wish I did? And if so, what's the question and what's the answer?
What's the problem that the focus on generative AI is causing in healthcare today? The answer to me would be, is we're distracting ourselves from areas that we need to have a more balanced focus on in addition to generative AI. You and I have spoken in the past about my passion around kidney health. And is the money and time that we're spending on generative AI taking money and time away from focusing on kidney health and devices that can protect our kidneys on the inpatient side? And I would ask one more question. What negative impacts could be caused by this over-focus on generative AI versus maybe what the clinicians would ask us to help them solve in the next 12 to 18 months? I would ask that question of the clinicians.
Wow. Thank you so much for coming to share your perspectives with me. I just want to leave listeners with a few takeaways. And as I take these notes during episodes, usually they're 3 to 5 things I want to leave listeners with. Today's going to be a longer list, so I hope they'll stick with me because it's worth it. So, some things I took from your insights, Todd. If we look through the job lens, we're overweighting the social aspect of generative AI, and we are undervaluing the emotional component. The most important question there is, can providers trust it? As we think about moving forward with generative AI in healthcare, there's a disconnect between the moneymakers and the decision makers. Health systems are in the rider's seat when they should be in the driver's seat. So the pathway to addressing this is establishing a rigorous process to understand the context clinicians are functioning within and establishing trust criteria by service line that would lead clinicians to trust AI in the moment of truth. In doing this, we need to remember that think flow precedes workflow. Generative AI won't shift workflow. It won't change how providers make decisions if they don't trust it, and it doesn't change how they think. To increase consumer trust in generative AI that's used in healthcare, we must be fully transparent with patients and consumers, and they must feel safe. When we think about the guardrails that are needed in the industry, they have to be defined by the moment that matters. I love that. Takes me back to journey mapping days and innovation. Guardrails have to be defined by the moments that matter, whether or not the clinician believes it's safe or meets their criteria for trust. We also need to think about data integrity governance by service line. And the question you added, what's the problem of focusing on generative AI today? What problems does that create? And it's we're distracting ourselves from the focus we need to have on pressing problems and the potential negative impacts that can be caused by this overfocus. Instead, we should shift our mindset to talk to clinicians and say, what problem could we solve for you in the next 12 to 18 months? So, Todd, wow, thank you. It's always great to talk to you. And I am so grateful that you took the time to share these insights today.
It's always good to see you, Ann Somers. Thank you.
Thank you for listening to Life-Centered Healthcare. If you like what you heard, please leave a review on Apple, Spotify, or wherever you're listening. And for more of the latest in healthcare, check out our website, christenseninstitute.org. You can sign up for our newsletter and read our latest industry insights. Until next time, have a wonderful day, everyone.